Hello, my name is Alexandra Kavanagh, and throughout the duration of this video I will be discussing the importance of consent in the preoperative phase of surgery, as well as the imperative role of the nurse in advocating for a patient in need. According to Hamlin et al., the perioperative nurse is a professional who provides complex care for patients in a high dependency situation. Richardson Tench state that the perioperative nurse is in a unique position as they have the privilege to be the consciousness of the unconscious patient. They design and put into place care specifically catering to the patient's requirements. One main function of the pre-assessment clinic is to obtain the patient's informed consent for the surgical procedure, according to Hamlin. Berry and Cohn state that there are two main areas of consent: general and informed. General consent authorises the attending medical team to perform standard day-to-day treatment or treatments and care deemed fit by the physician, whereas informed consent states that it is the physician's duty to ensure the patient knows the risks, benefits and alternatives of a procedure to obtain consent before treatment. Written consent based on an informed decision should be obtained before any investigational item, drug or procedure begins. Although the surgeon has the ultimate responsibility for obtaining informed consent, it is the duty of the circulating nurse to check the patient's identity and chart on arrival to the operating room, as well as making sure all appropriate consents on the form are completed, dated and signed, and also ensuring all the information on the form is correct concerning the patient, procedure and medical personnel involved. Albina is of the opinion that nurses have a professional and ethical responsibility to advocate for their patients. She states that in order to do this, the nurse must open communication, provide education, establish competency, and create a code of mutual respect. Albina implores that nurses are ethically bound to uphold and promote patients' rights. The American Nurses Association emphasises that the nurse's primary commitment is to the patient, that the nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. Advocacy is of the utmost importance for surgical patients because after they are anaesthetised, they are unable to make decisions about their treatment. Thus, it is left in the hands of the perioperative nurse to act in the patient's best interests. Throughout this video, I have discussed the components and purpose of a valid consent for a surgical procedure, and also looked at the role of the nurse in a perioperative setting regarding patient advocacy. Thank you for watching.